Everything's ready here. Okay. Hey guys, welcome to our office hours. We're just going to go ahead and give everyone a minute or so, make sure that we're all good to go. In the meantime, let me go ahead and introduce myself and who Paloma is. So my name is Alex Ruiz. I am the Director of Marketing here at Paloma Health. Paloma Health, in case this is the first time you have heard about us, you're not a member yet, we are a full online medical practice. So meaning that providers like Dr. Yasmin here, who's our special guest today, can see you from the comfort of your own home. And what I mean by full medical practice is we don't just kind of see you and do lab testing, which I'm sure some of you guys have seen our at-home lab tests, which is great, our thyroid kit. We do medication management, so we can put in medications. We offer all medication types, consider all medication types, and we can even do labs as well. Let's say if you don't want to do the kit, you would rather go through your insurance. We have that option as well. We work with your insurance depending on your provider. We offer different guides and everything and plenty of resources. We have a mobile app, which is completely free, has guides, meditations, workouts, recipes. A lot of our providers, especially when it comes to thyroid care, love to implement the AIP diet, which helps reduce inflammation, which I'm sure we will get to later on in our office hours today. But we have plenty of resources on that, blogs on our website, and so much more. So if you want any more information about our membership and how that works and just overall thyroid care with Paloma Health, you could go to our website at palomahealth.com. And in the meantime, let's go ahead and get started. I see we have more and more people joining us, which is super exciting. So without further ado, I'm going to go ahead and toss everything off to Dr. Yasmin, and she will go ahead and take over and host our office hours for today.
Hi there, guys. My name's Dr. Yasmin Akhunji. I'm a board certified internist and endocrinologist. I've been working for Paloma for a few years now, have a special interest in thyroid, Hashimoto's in particular, have both of those issues myself. So I completely understand and sympathize on how confusing and stressful this disease is, especially in the start of this whole process and journey for you. So I'm excited to answer your questions today, and I guess we'll go ahead and get started. The first question I have here is a suppressed TSH while on Armour and Cytomel dangerous or a concern? All my other numbers are great and I feel amazing, but my TSH was very low. So the biggest concern that we have with this, honestly, is twofold. The first is we know that as your TSH gets suppressed, it's your brain's way of basically saying, hey, I feel like I'm getting too much thyroid hormone, even if the other numbers look okay. And two things happen. The first is that your bone turnover markers can increase, which means the breakdown happens faster than the build back up. And that can lead to things like osteopenia and osteoporosis. So especially as we age, as a lot of our patients are female, as we hit menopause and we're losing some of that bone protection from the estrogen and progesterone as it is, those things become a higher concern. So we definitely don't want to increase your risk of bone loss. The second part of this is honestly that there's an increased risk of also cardiac arrhythmia. We do know that things like atrial fibrillation increase as that TSH decreases as well. And that can increase your risk of cardiac events and things like that. And again, as women, we kind of present in a different way. And so oftentimes our typical presentation of chest pain and things like that aren't exactly the same. And we wait, unfortunately, a little bit too long to seek help, and that can lead to issues itself. But again, those are the two biggest concerns, and why your provider kind of, I hate to use the word harp, but why we kind of harp on trying to normalize that TSH is because we don't want to increase your risk of bone loss, and we definitely don't want to increase your risk of cardiac arrhythmia. Now, here is the next question. They've been using Paloma for a couple of years now, and they would like to try Tirosint SOL or Armour instead of current prescription of levothyroxine. Is that something you would recommend / allow? Yeah, either would be a great option. Now, I will tell you the difference between Tirosint SOL and Tirosint in general, and then divert that back to Armour. Tirosint SOL stands for solution. It's the liquid form of thyroid hormone. The nice things about it is there's no binders or fillers in it. In the solution specifically, it almost looks like, I don't know if you guys remember this because I'm aging myself now, but the old Pond's kind of droppers that they used to have, and you used to put that on your hand and put it on your face. Well, it kind of looks the same. You're just swallowing that instead. So really there's no binders or fillers. It's pure thyroid hormone. Tirosint, on the flip end of that, not the solution form, is liquid thyroid hormone in a gelatin capsule. So as long as gelatin is not a deal breaker for you, that's another option. Now, tirosint's benefit is that your gut absorbs it really well because there's no binders or fillers changing that absorption. Typically, patients with gut issues tend to do better on it. Now, Armour thyroid, on the flip end of that, is pig thyroid hormone. The biggest difference between that and levothyroxine is that Armour thyroid and P thyroid, nature thyroid, all of these drugs, they have both T4 and T3 in it, whereas levothyroxine is just T4. So it works great for the patient that needs both things, T4 and T3. However, if you're somebody that converts over to T3 well as it is, probably wouldn't recommend doing it, because a lot of times if we give you too much T3, one, we can cause that TSH suppression we talked about earlier. But the second part of that is a lot of times those palpitations and kind of anxiety, jittery feelings can get exacerbated when you have that extra T3 on board. So that's the other concern we have with that. Now, the next question is, how do you most efficiently build your ferritin stores? And specifically, what is the optimal ferritin range patients should aim for thyroid health? Same question for vitamin D and B12. So that's an interesting question. I wouldn't say there's an ideal number for ferritin specifically. We always want to shoot for a normal range. The big thing that you have to be careful with ferritin or iron supplementation in this case is iron and calcium specifically, as well as magnesium, but we can talk about that later. Those are big binders to thyroid hormone. And so you want to make sure that if you're taking that, you want to separate it out by at least 4 hours, separate it out from the thyroid hormone specifically so that you're not binding there. Same goes for vitamin D. Well, not exactly the same. Vitamin D, the range typically in most labs is 20 to 80, but we do see that if you start to hit a vitamin D range of over 60, a lot of patients will start to have hypercalciuria or calcium excretion in their urine, and this can cause an increased risk of kidney stones. As far as B12 goes, B12 is a water-soluble vitamin. So we just want to make sure you're staying in normal range. I believe the range off the top of my head is up to 1100. So we don't want to push higher than that. Although I will say that vitamin B12, it's water soluble. So all the extra that you get, you're basically going to urinate off. So it's really hard to overdo that one there. Now, I would always check with your doctor about your other medications and make sure that there's no other interactions. But like I said, the biggest interaction concern would be with the ferritin or the iron supplementation, mainly because that can cause issues for your thyroid hormone. Next question is, can hypothyroidism, Hashimoto's, and thyroid medication affect your period? Absolutely. So getting too much or too little thyroid hormone can absolutely affect your menstrual cycle. Any of these things can throw off your period. It can be heavier, it can be lighter. I think it's important to optimize your thyroid levels. And then if you're still having issues, just because you do have thyroid issues doesn't mean that there's not also something else going on, whether it's PCOS, endometriosis, things like that, anovulation, so just not ovulating every month. So definitely also talking to your gynecologist is really important there as well. But again, the main focus for us would be trying to get your thyroid within that normal range, getting you feel as best as possible. And then if you're still having issues, again, to talk to your gynecologist is the next step. The next question is there a connection between hypothyroidism, Hashimoto's, and nasal allergy symptoms? I seem to have constant nasal congestion. Well, I would say that folks with Hashimoto's or hypothyroidism are at an increased risk of autoimmune disease. I wouldn't necessarily say nasal allergy symptoms specifically. I think that also happens to be regional and probably also due to general overall health. So I think if you're having other health issues, whether it's sinus, chronic sinus issues, chronic ear infection issues, chronic respiratory issues. All of these things can kind of contribute to that. I would say that if your thyroid or Hashimoto's are doing okay, meaning you're otherwise feeling well, I definitely consider seeing an ENT to make sure that you don't have any of those, direct sinus issues also. The next question is, what are your thoughts on iodine supplementation? So that's an interesting question. I think the biggest concern with iodine supplementation and Hashimoto's is that too much is not a good thing in this case. You can definitely overdo iodine supplementation. So, what I would recommend is that you talk to your provider about how much you're taking. Now, in general, and this is kind of a tricky thing, if you eat a quote unquote normal American diet, so you're eating out more than once or twice a week, you're probably getting enough iodine in your diet via, eating out. And you probably don't need the extra supplementation, to be honest. Now, if you're strictly eating at home, you're meal prepping, you use, let's say, Himalayan salt, then you might need to supplement a little bit, but I would definitely make sure it's okay with your provider from a safety standpoint, because we can make that Hashimoto's worse for sure. Next question is, my TSH has been the same for years, but regardless of what I do, I can't lose weight. I eat healthy and exercise daily, walk 7 to 9 miles, bike 9 miles, light weights, and I'm always moving. Why now? Never had this problem before a thyroid issue. Help. Oh, that is so frustrating. And weight is a frustrating issue that a lot of us face with hypothyroidism and Hashimoto's in general. Now, unfortunately, the fact of the matter is that weight can be multifactorial. I think a lot of things get harder once you have hypothyroidism for sure. But another question is do you have an underlying metabolic issue? Are we looking at a undiagnosed Cushing's? Are we looking at insulin resistance? A lot of us have heard about those GLP-1 drugs that are super popular right now, the positives and the negatives on the media. However, if you do have insulin resistance, that's an option and might be a viable option to help you break through that weight. The other thing is it's really important to work with a nutritionist, because maybe there's something that you're doing in your diet, although healthy, that might be leading you to gain a pound here or there. It sounds like you're super active. And the other thing you want to keep in mind too, even though you're working out a lot, is you might want to change up the workout a little bit, maybe a little bit less cardio, a little bit heavier on the weights, because you will want to build that lean muscle, because that's going to help you burn through calories also faster. Next question is, I am a 72-year-old and have been on levothyroxine for 50 years to treat my hypothyroidism. Is there hope in this stage of the game to gain energy, maintain my weight, stop being cold most of the time, manage symptoms? Would you recommend Paloma Health as a good place to start, or is this just too late for me? I've always heard that you're old and your numbers look good. Well, it's hard to say, because some of these things are multifactorial. So I do think energy, a lot of it can be due to your hypothyroidism. So yes, while your numbers are in range, one person could feel great at a TSH of 1, another person might feel great at a TSH of 2 or 3. It depends on the person. And this is why working with your provider and trying to optimize it is so important. As far as maintenance of weight, we kind of touched on that a little bit earlier. Sometimes it can be multifactorial. Definitely, if we get your thyroid optimized and you're still facing some weight issues, then again, looking to other possibilities of what's going on. And I think a lot of the things that we need, to check or dive into is, what's your diet like? What's your exercise patterns like? How are you sleeping? Is your sleep disrupted? Are you like me and have 2 little monster dogs who are the sweetest things, but they disrupt my sleep and they wake me up probably 2 to 3 times a night? These things can kind of impact, again, how you're metabolizing things, how your energy levels are, and ultimately it does impact your thyroid as well. So I think it's worth it to work with a provider to see, what other things we could be optimizing for you. Now, what is the relationship between levothyroxine/Synthroid and the worsening of reactive hypoglycemia after thyroidectomy? What about the worsening of allergies after thyroidectomy? Well, I don't have a direct correlation that I've read on how people get worsening reactive hypoglycemia after thyroidectomy. I would say that your the metabolism is going to be a little bit more sensitive to things, and possibly you're already somebody that needs to eat every 2 to 3 hours, which is actually not that uncommon. But it might also be taking a look at your diet patterns and maybe trying to implement a little bit more fat and protein with those carbohydrates that you're eating as well. So I think that if you're experiencing that, I would definitely talk to a nutritionist or dietitian to kind of focus in on that and kind of see how your patterns of eating are. And maybe even considering something like a continuous glucose monitor or a CGM so that you get out warning preemptively that your blood sugars are dropping. And the second part of that question was, what about worsening of allergies after thyroidectomy? Now, again, this is an immune response to your body. So a huge immune stressor sometimes. I wouldn't say there's a direct correlation. So I couldn't tell you, hey, this is the pathophysiology on that. I will say some people are more sensitive to getting colds and allergies afterwards. Why that is, maybe it has to do with the immune path of all of this. Again, going back to what we talked about a little bit earlier, maybe seeing an ENT or an allergist is a good idea, though, to kind of figure out, is it a food trigger? Is it an environmental trigger? So if it is something that we can risk reduce, we'll try and do that. Next question is, can you discuss some options for keeping thyroid levels similar during the day rather than the peak annoying hours after taking the medication? So I think that has a lot to do with what type of medication you're on. Um, T4 is a long acting medication. So when you take it, you typically shouldn't have like a peak in an hour or two, or it should hit a pretty quick, stable, steady state for you. Um, I think the biggest thing is T3 is a shorter acting medication. It's also just its natural mechanism is that way. So you are going to get more of a peak and valley with that. So if you are on something like, let's say, Armour Thyroid or Cytomel/Leothyronine, you might get a peak and valley. But the other thing is you might not want to get a second dose in the afternoon, depending on the person, only because that might disrupt your sleep at night. So again, trying to get to optimal levels with your provider is important. I don't think there's anything that you should change necessarily dietary wise, but it might be time to talk about changing your medications up if you are feeling big peaks and valleys with those meds. The next question down is, I was wondering about T3 only treatment for hypothyroidism. Also, any comments on availability of NDT, including Armour Thyroid, West Thyroid, NP Thyroid, etc. So it's interesting. I've been getting more questions on T3 only treatment. Honestly, it's typically not recommended from any of the endocrinology societies. So the American Association of Clinical Endocrinology, the Endocrine Society, even the American Thyroid Association, none of these three really recommend T3 only treatment because physiologically our thyroid makes T4 to T3 at a ratio of about 14:1. So we are making much more T4 in general. Now, availability of NDT, Armour Thyroid, NP Thyroid, West Thyroid. As far as I know, the natural desiccated thyroid hormones are not currently having any shortages. At least I haven't been told by any of my patients that there are, or any of the pharmacies. Armour Thyroid and NP Thyroid should be pretty well available. West Thyroid, honestly, I haven't used in a while, so maybe that might be an issue if that's what you're still on. But Armour Thyroid and NP Thyroid should be readily available. Next question is, I have been gluten-free for 3 years, medicated on levothyroxine for all of that time, and am now also medicated with leothyronine. My TSH, T3, and T4 numbers are good. However, my antibody numbers are still really high. I continue to feel exhausted on waking, but wired at night. I am still losing a lot of hair and have continued brain fog and concentration issues. What else could I change about my diet and or lifestyle to help maintain these symptoms? Well, one thing you might want to talk to your provider about first off is that the levothyroxine that you're on, is it actually gluten-free? There's only 1 to 2 manufacturers that I can think of off the top of my head that are gluten-free. The other ones do have a little bit of gluten in the filler. Now, if you are somebody that truly has a gluten sensitivity or a gluten allergy, you are going to want to eliminate that, because you can imagine you've been avoiding it in your diet the last 3 years, but then you go ahead and you take it in the morning, and then all of a sudden it triggers your gut. That might also be some of the exhaustion and the feelings of being wired. The other thing is we should probably talk about your diet in general. Maybe it's not just a gluten sensitivity. Maybe you have sensitivities, you're like me, and dairy messes you up, or soy, or foods in the nightshade family. These are much more common in people with Hashimoto's and hypothyroidism. So it is something to consider, also eliminating those as well. And as far as exercise goes, then again, going into the lifestyle part of it, low intensity interval training tends to be a little bit easier on the autoimmunity part of this, and people tend to do better. So things like yoga, stretching exercises, light weights, things like that tend to build better with the inflammatory portion of this. So that might be something you want to incorporate into your lifestyle as well. Might not necessarily help with the hair part of it, but might help with the brain fog and concentration issues, and that getting that regular exercise is going to help trigger things in a positive way on that end. As far as hair loss goes, I would recommend getting a full workup to make sure something else isn't going on. Earlier, we mentioned vitamin D and iron. Those are super common reasons to have hair loss. Also know that if you're taking any hair, nail, and skin supplements like that have biotin in it, for example, those can cause your thyroid levels to be wonky. So to let your provider know that as well. Next question is, I have a skin rash on both sides of my neck and forehead. It's red and itchy and dry. Could this be related to my Hashimoto's? So yes, some people do experience more skin reactions or skin reactivity with Hashimoto's and hypothyroidism. In reducing things or trying things like the AIP diet, the autoimmune protocol diet, or trying to optimize your thyroid levels are important. Now, if they continue to happen, could you also be having something going on concurrently, like really bad eczema, really bad, maybe it's a detergent that you're using that your body doesn't like. So all of these things are also possibilities. So if it continues to happen, despite, you optimizing all your lifestyle stuff and your medication stuff, I would also consider seeing a dermatologist to see if there's anything else going on possibly. What is the most common typical root cause of Hashimoto's and hypothyroidism? So most commonly, honestly, it's nothing that you're doing or not doing. It's genetics. TPO antibodies are something that's genetically made. Why your body turns it on at some point versus not, it's hard to say. A lot of women in particular experience it around having a baby, or a lot of times around menopause. But it is probably something that you didn't do to yourself, or you didn't miss something environmentally. It's an autoimmune disease. And when you have one autoimmune disease, there's also an increased risk. So just keep that in mind. If you're somebody that, let's say, has lupus or type 1 diabetes, you might have an increased risk of Hashimoto's and hypothyroidism. But this is one of those things where most of the time we do think a lot of it has to do with genetics. And so thanks, mom and dad, typically mom, unfortunately, in this case. But again, what we can do is try to attack it as much as possible and try and do all the preventative stuff to help you with your symptoms. Next question. Just had a parathyroidectomy. One parathyroid gland removed due to overproduction. They called it hyperparathyroidism type 1, where calcium is being pulled from my body into the blood and urine. My post-op care is to take high doses of calcium in the form of Tums. Yes, Tums. Wondering a more holistic approach to this. So this is really tricky. So your parathyroid glands, there's 4 of them. They sit right next to the thyroid gland. They're responsible for your bone metabolism. Basically, your bones break down and build back up. We talked about this earlier with the osteopenia, osteoporosis. If you have primary hyperparathyroidism, the breakdown happens a lot faster than the buildup. Now, in theory, if we're removing one of the parathyroid glands, the other 3 are supposed to kick back in and substitute off what that one parathyroid gland was overdoing before. However, after surgery, sometimes they can go to sleep, or sometimes they can be damaged during the surgery, depending on how extensive the surgery is. And so in those cases, a lot of times the surgeon will recommend that you go on short-term calcium. Unfortunately, not very common, but it can happen. You can go on calcium long term. You might need a drug called calcitriol as well. It doesn't sound like that's your case, which is good. I'm glad you don't need that. But, there's not unfortunately, there isn't a way to wake up the other parathyroid glands quicker. I would just say the best thing is to take the calcium or the Tums in the meanwhile. A lot of people use Tums because it's a little bit easier on the stomach, but you could take calcium in other forms if you want to take it through a supplement. That's also okay. Tums just generally tends to be a little bit easier on the stomach. That's why people go with it. Next question. So thyroglobulin antibody is 84.4, which is high, and TPO antibody is 510, which is also high. Is that Hashimoto's or cancer? Scan says heterogeneous multinodular hypervascular thyroid as above. Recommend correlation for etiologies such as Hashimoto thyroiditis. Should I be worried? So TPO antibody is how we check you for Hashimoto's. That coincides with the ultrasound find, which is heterogeneous, which just means your tissue looks uneven. That's all it means. Kind of a Swiss cheesy appearance, if I had to describe it. Hypervascular means you have a lot of good blood flow through that thyroid, which often happens when your thyroid's irritated. Anytime you see the word itis means irritation. So thyroiditis means your thyroid is irritated. So on that note, it sounds like your ultrasound is consistent with Hashimoto's thyroiditis. Now, they don't mention a nodule. Nodules are typically where we start to worry about thyroid cancer. Now, the reason so many people get worried about this is thyroglobulin antibody is a tumor marker that we usually use for people that have thyroid cancer. But the reason that we use it as a tumor marker is when you have a total thyroidectomy and the thyroid is out, you should make zero amount of thyroglobulin or thyroglobulin antibody because you don't have a thyroid anymore. And so I wouldn't be as worried about this, but I would talk to your provider about it, review that ultrasound with them, but it doesn't sound like there's nodules there. So I would say your ultrasound result and lab results to me sound like Hashimoto's thyroiditis without looking at it myself. Now, the next question is, I've been stable on T4, T3 for many years with low suppressed TSH. Original diagnosis was large goiter, never positive for Hashimoto's, nor had antibodies, but many family members with non-Hashimoto's hypothyroidism. Every new doctor takes me off the T3 claiming low TSH means subclinical hyperthyroidism. Then the free T3 plummets way below normal with hypothyroidism symptoms as TSH goes up into normal range with all the other tests remaining normal. No nutrient deficiencies and good gluten/dairy-free diet for many years. Is this what poor conversion of T4 to T3 looks like? Any other solutions besides T3? This might be the case where we were talking about earlier where something like tyrosine might be a good idea. It might be how you're absorbing the T4 and therefore not converting over to T3 well. I agree a suppressed TSH in the long run is not the best thing for your bones or your heart. But it might be that you need either a really low dose of T3, maybe half a tablet, like 2.5 micrograms without knowing what your doses are. Or you could try something like tyrosine where your gut absorption might be a lot higher and therefore do a lot better. And so, that might be our other way of taking care of it. So I would definitely talk to your doctor about tyrosine being an option potentially for you and hopefully kind of helping you get in a more steady place. Next question. Does collagen supplements affect the TSH level? I've been using BioSil, which is supposed to help your body make collagen. Recently, my meds were dropped from 88 micrograms to 75 micrograms of levothyroxine. So most collagen supplements shouldn't affect your TSH levels if it's just purely collagen. I don't know without reviewing your other supplements, it would be hard to say, and I'm not familiar, especially with BioSil. I don't know if there's biotin in it. That could be making your labs look wonky, but it looks like for some reason your medication was probably dropped because you're absorbing it better, presumably. But like I said, collagen supplement typically should not affect your TSH level. That should be pretty steady, with this regardless. Okay. Sorry about that. Just waiting on the next question. Okay. So this next question. A really significant book in the field of thyroid treatment came out just a little over a year ago, Rethinking Hypothyroidism, Why Treatment Must Change and What Patients Can Do, written by Antonio Bianco, MD, a renowned scientist, researcher, and former president of the ATA. After decades of research, he says T4-only treatment is failing some 10 to 20% of thyroid patients who do not convert effectively. These patients require other treatments in options including NDT and T4-T3 combo therapy. He apologized for the medical establishment's history of resistance and denial, and then goes on to recommend patients work with their doctors to adjust medications till they're right. But most doctors, especially notoriously endocrinologists, are so entrenched in T4-only therapy, they are adamantly opposed to anything else, refusing to even run the tests necessary. Patients who push for NDT or T3 often end up being infantilized and gaslit, even dumped for being non-compliant. So how can we patients with little power and influence advocate for what we need, what works for our individual bodies, when so many doctors are still so completely unwilling to rethink hypothyroidism, as Dr. Bianco puts it? More broadly, how can we persuade the medical profession to loosen their dogmatic adherence to flawed beliefs and ineffective treatment practices when they refuse to listen even to one of their own? So I don't think that the problem necessarily, well, yes, there's problems within the provider themselves if they're not willing to listen. However, it's hard because the guidelines don't really specify T4 versus T3 treatment. I think that's changed a lot in the last decade of treatment itself, but guidelines right now don't specify T4, T3. We have this kind of wishy-washy area, the 10 to 20% that Dr. Bianco recommended or said that still have symptoms despite just using T4 treatment. And we know that those patients exist. I personally use T3 treatment and NDT. I think it's really important that you find a provider that listens to you and finds a provider that's a good match for you. So if you feel like your provider's not listening to you, it might be time to get a second opinion, sometimes a third opinion. And again, there should be at least a reason why, as to why they don't want to try it. Again, if the reason is, I think I'm going to suppress your TSH, I think I'm going to cause increased risk of arrhythmia or bone loss, then that's one thing to consider. But they should at least be able to provide you a reasoning or a backing as to why they don't recommend it. Just saying because that's not how we do it isn't really a good rationalization. But also keep in mind, there might be a reason that your provider doesn't want to do it. Maybe they've discussed it. Maybe they haven't discussed it with you. So it is something worth bringing up and being an advocate for yourself. But I think it's important to also find, just like with anything else, whether it's a gynecologist, a primary care doctor, it's important to find somebody that listens to you. So on that note, I would say it's really important that you find someone that, again, listens to you and work with them. Okay. Next question, if I have my thyroid removed, will I no longer have Hashimoto's? So technically, you can still make the antibodies and the antibodies can still be present. You no longer will have the thyroid causing you the issue there. So most of the time the thyroid's removed because there's a goiter or nodules within the thyroid. That's going to be your most common reason that it's taken out. Generally, we don't recommend taking out a thyroid just because of Hashimoto's itself. At this time, guidelines might change, God knows. But right now, generally we remove it for other reasons. But I think, again, the important thing after all of this is figuring out what's your correct dosing. I'm trying to get you optimized because now you do have surgical hypothyroidism and we need to address that for sure. Last question. I use propolis to get my iron naturally. I cannot tolerate red meats and I'm not able to take over-the-counter iron supplements. This may be helpful to others in the group. I guess that wasn't really a question, but that was helpful. So thank you for sharing that. Propolis, I haven't actually heard of that before, so I'm gonna have to take a look into that also. But if it's a natural way of getting in iron, I think you have to do it how you can do it. So whether that's, getting in kidney beans if you're a vegetarian or vegan, or eating more red meat, or taking the supplements. Supplements sometimes can be harsh on the stomach. I agree with that. They tend to constipate a lot of people. And remember, the timing of that's really important. So separating out by 4 hours from your thyroid hormone. But I think we're going to end here. Thank you for being here with me today. And I'm going to shoot it over to Alex.
Yeah, thanks, Yasmin. Thank you guys so much. We had so many questions. We couldn't get through all of them, but I appreciate you guys all submitting. Again, if you would like to become a member and book an appointment with a provider like Dr. Yasmin, all you need to do is become a Paloma member. You go to our website, palomahealth.com, sign up for the membership, and then depending on your state, you can book an appointment with Yasmin. So with that being said, thank you so much. That wraps up our January office hours. We do have office hours every month. So make sure that you join our community at community.palomahealth.com, and you can sign up and RSVP and get notifications for all of our events and everything, including our upcoming February office hours. So without further ado, thank you, Yasmin, so much for hosting today's office hours. And thank you, everybody, for attending.